the leadership for carefully and also deliberately selecting the theme and the sub-theme of this AGM. Because if you look at it, it is talking about our own lives, what will actually lead us to Jannah. Because that is the ultimate, and that is what we are all praying for. And that is why we are living at this time. So you can see that humanizing today's healthcare. Everybody, I think I don't need to emphasize more that the healthcare, quite all right, is sick. And Dr. Mohammed Sadiq have done a lot, have actually talked a lot. Even the little that I could add, I think what is remaining now is to see how we can translate what he has said into our practice, because it shouldn't stop at this point. Dr. Sadiq have quoted indices, but I think even such indices are just for the Western world, where things are being done properly with clear supervision and so on. He has mentioned issues regarding the healthcare. One that he mentioned very cardinal is the access. We may not do much about the access, but what about the professional care that he has mentioned? So now, are we ready now? Are we going to swear now from this, that when we go back to our various institutions, that we are going to be vanguards of making a difference? Because I don't need to mention whether as a doctor, as a nurse, as a medical laboratory scientist, and so on, there is no doubt that the community have no trust in us. And that is what he mentioned about the patient-centered journey. That trust is very important. So how can we now to rebuild our trust? To make the healthcare system in Nigeria, in terms of the professional care, nobody is going to do it for us. But anytime when we start talking, everybody will be talking about government. But what are we doing at our own levels? Most of us are kings and queens in our own small units. Is it how it's supposed to be? You are the professional knowledge. Are you putting it in place? Are you helping the institutions with your knowledge in order to make the system better? Whether as a doctor, whether as a nurse? Do you give a proper leadership? Let's start from ourselves before we talk to others. So you're coming from Kebbi, Sokoto, Ilorin, and everything. Ask yourself, are you really an exemplary leader in the healthcare delivery that we are all wish to have? Are you among the people that would be making calls while patients are talking to you? Or you would be browsing, looking at Facebook, looking at WhatsApp while you are on duty? As a nurse, do you have SOP for all what you are doing on the ward? Even as simple as using the sphygmomanometer. What do you do as a laboratory scientist when you come to work? Do you really do the work, or you assign the genius without supervision and just go? How do you manage your ward as a manager? Do you report to the management? Do you write reports? Do you follow up to check even what you are using as a tool? What efforts are you making to make the tools available? A lot of things we should ask ourselves. Are you the type of person that when patients are talking to you, you feel like they are adding more burden to you? Or you are the type that whenever patients talk to you, you will smile and welcome the patient and talk to him in a manner that he will now have care? Because as Dr. Sadiq had mentioned, there are so many things they don't need injection. He has mentioned they don't need injection. In fact, there are so many people that are coming, they will come more than 20 times. It is just that because they have not gotten a person that will talk to them. When you come, before you start talking, prescription and everything you have given. And that is not what the patient is asking for. Ask yourself, are you among the people who are killing patients on the ward? Some people will just look at it as harsh, but that is actually what is happening. If you come to the ward as a nurse, there is a suction machine, and you went and sit without checking the functionality of that suction machine. It is when the need arises, then you go and you found out that it's not working, you have killed that patient. How many times do you validate the sphygmomanometer that you use to be sure that it is giving you the accurate result? If you are in the laboratory, how many times do you validate your system to make sure that the glucose level that you give is actually the glucose level that is supposed to be for that patient? If you are a doctor, how many times and minutes do you take to look at this patient? It may amaze you to know that personal experience, we have seen that anytime when you talk to the healthcare givers, they will tell you that the workload. When you try to reduce the workload, that is when they will start making arrangement of not to come to work. No, this one we have a practical experience. It's not about whatever. There was a time that we went as low as giving doctors particular number of patients that they desire to see. But when we did that, then they started closing the clinic by 11 a.m. So how many minutes do you have per patient that you started seeing patients from 8 a.m. and you close by 11:30? Saying that I have exhausted my patient. Is it not 20 patients I have seen? There's no trust. So please, He has given us everything in blood, but just be mindful that Allah subhanahu wa ta'ala is going to ask all the level of leadership in the healthcare. There is no proper supervision, no proper assessment, nothing. Everything was just left to the chief executive. People will just be talking about the chief executive. The chief executive is the ultimate in that institution. Whatever that will come to him, then everything should be seen that everything has been put in place. So let us, all of us, go back and think. Always think. You are coming to work, your children will tell you that, Baba, okay, you have gone and spent 6 hours, 7 hours. What have you contributed to the system? Or it is just after the end of the month, you will be worrying everybody that alert is yet to drop. Okay? So please, let's sanitize what we are earning. If not, at the end of the day, you will find out that what you are earning is haram. And you know what that means. Let's try as much as we could to translate what Dr. Mohammed Sadiq have actually said, especially about, because we are the only people that can change the system. People will not come from heaven. And the IMAN have started their journey. Please, let's all of us join the trend. It's not going to be an easy ride, but we believe one day it is going to be something to celebrate. Let us all be safe in wherever we are. If in your institution of care that your wife or your relatives are ill, that you have to come in order to assist them for the care, that institutions need to be reviewed. That means you are not safe. Let's build a very safer and reliable healthcare delivery in Nigeria. Let's humanize our own institutions to be institutions with human face, so that the trust and the patient-centered journey will be straightforward for everybody. And I'm telling you, a lot of miraculous things will come to the healthcare delivery in this country. May Allah continue to guide us and make our journey much easier. Assalamu alaikum.
We're very grateful for that and goodwill message from the Chief Medical Director. We would give Dr. Hajia Halima Mukaddas 5 minutes for a goodwill message. She's our neighbor from Ningi.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. The chairman of this occasion, Professor El Nafati, ably represented by the DVC academics, and the chairman of the LOC, my brother Dr. Abakar Saidu Abakar, sorry, I said it the other way around. And Chairman National IMAN, Prof. I think even if I want to say I want to stand on already established protocol, I have to mention some people that are dear to me. In this occasion, I'm here very close by is my brother-in-law, or my brother, because he's married to my best friend, who I've seen sitting down here, Professor Hajara Omar. This is a friendship that has transcended 30-something years. So she's not just a best friend, she's also a sister. So now I can say, let me stand on already established protocol. Assalamu alaikum. I'm happy to be here because in the medical profession, everywhere we go, we are a family. And as families, we know that it's difficult sometimes to meet everybody. But when you come to such gatherings and you meet so many wonderful faces, some you have not seen for quite a while, some you have never seen actually, but when I meet you here, I consider that, yes, I now know you, and subsequently I know this is my sister and this is my brother. So I'm happy to be part of this ummah and part of this family. While I'm particularly grateful is because we are one of the single few that Allah has favored. Having created us Muslims, that's the first favor. Then he now put us in the best of profession, to care for others. I think that's a wonderful opportunity that we should use. You should use this opportunity to take us to Jannah. Mine is a goodwill message. So I'm really not going to give a lecture like my brother, Dr. Yusuf. But I wanted us to remember that. So we can use that opportunity to lead us to Jannah, and we can still use that opportunity and abuse it to lead us to the other way. Well, yes, Billah. I hope we will always remind ourselves that this favored position that Allah has bestowed upon us can be used in a great way. I wish everybody that comes here to benefit from the lectures we are going to listen to and to utilize some of them, if not all. So I wish us non-eventful gathering, actually. Let all of us go back to our various. Just a little bit about the National Obstetric Fistula Center Ningi, because I know some of you are hearing the name for the first time. We call it NOFIC for short. NOFIC Bauchi State is specifically established to care for women, especially women that have problems from the pelvic region downward. One of the problems is obstetric fistula, but we know there are other problems of women. So it's not carried within the name. Only the obstetric fistula is carried in the name. So we see mostly women, but we see few men too in our general outpatient. So we do surgeries for all the pelvic conditions. We do surgeries for things like cystocele, stress incontinence. We do surgeries even for the vaginal region, that problems of women and problems of marriage. So in short, that's what we do. So we take care of women that are pregnant, we take care of women that wants to give birth, we do cesarean section. So we have experts in that particular field. So we're a specialty hospital for women and women problem. I hope we're enlightened. Assalamu alaikum.
Dr. Mukaddas, for those who don't know her, she was the former Commissioner of Health, Bauchi State, and also a specialist in obstetric and gynecology. At this juncture, I would like to invite the VC, Penn Resource University, Professor Yusuf Amuda Yahya, for his goodwill messages.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, ladies and gentlemen, the organizers of the program. I want to begin by thanking you first. A few weeks back, when they approached us that they have a program in Gombe, IMAN, and they want PRU to provide accommodation. I told my pro-chancellor I'm very glad for two reasons. I am a mathematician. I've been in the teaching profession now for 34 years. And I've been a professor for over a decade. So I can say one or two things about education. I usually consider medical profession, I compare them to cow. You know, when you compare cow and dog give birth to many children, but you cannot see a market where dog is sold. Cow give birth to only one or two, but everywhere, you don't need anybody to introduce you where you can get a cow. Almost every home eats cow. So the only difference is the baraka on cow. And that is what I usually tell my students. If you try and go for anything medical, you are likely going to enjoy more Rahmah of Allah than the other ones. So I was just telling the person I sat with, when we were young, there were, if in the whole of Nigeria, I'm not sure we have up to 10 doctors that time who are indigenous. I can remember Dr. Barau Diko, Dr. Hamdan Luku, and a few others in the 71, 72 when we were in school. But in the villages, we had health workers who they call them, whether auxiliary, whatever, I don't know what they call them. They did exactly what the doctors are doing today. So I was asking him, can't IMAN think of providing these auxiliary workers to some of these our remote villages? You heard what Dr. Sadiq said. Even when there is no insurgency, to move out from that village outside, you need almost 2 hours. You can ride machine at any time. In the night, you can put your pregnant woman on machine, bicycle, and go out. But now, even in the daytime to move, insurgency got you scared. But if we can provide these health workers to be in this remote part of the villages, I think that's another area IMAN may have to look at. I know you are trying your best on medical personnel, the doctors, they are coming up, because my own university, Penn Resource University, we had an agreement with the Federal Teaching Hospital This year, we are to commence BSc Nursing, BSc Medical Laboratory Science. But if you look at the number of students we are going to produce, they certainly cannot be enough. So, IMAN, please don't be fed up with the society. Allah will continue to put barakah on your activities. On behalf of my manager and those of us who work with PRU, we wish you the very best of every occasion. Thank you very much. Jazakumullah.
We say Jazakallah khair to a professor. I'm very sure when he was talking our trainees at the leadership training program, you will recognize him. And because that is the university that provided the free accommodation for us and provided very good rooms, neat rooms. I think we are the one that launched the rooms with new mattresses. So our students really enjoy that. Jazakumullah khair. Penn Research Investment. Allah bless you. We're very grateful. Yes, quickly, we're going to presentation of the Al-Ijtihad magazine. That is the striving of IMAN. So the president will give a run through.
Assalamu alaikum wa rahmatullahi wa barakatuh. Briefly, I just want to present to us the IMAN Al-Ijtihad magazine. There is saying that anything that is not documented is not done. And so we have taken it upon ourselves to document all our activities for the purposes of our records, for the purposes of enlightening the public, and for the purposes of visibility, so that IMAN can become more visible in the international community. The Al-Ijtihad magazine comprises of reports from various state chapters and also the various committees of IMAN. So apart from the individual reports from the states branches, we also have several committees like the Addiction Prevention Committee, the Save the Dignity Committee, the Safe Smile Committee, and several other committees. So all of them are embedded in this report. And so therefore, on behalf of the National Executive Council of the Islamic Medical Association of Nigeria, I, Ibrahim Oreagba Adekunle, hereby present to us the main mission of the IMAN Al-Ijtihad magazine, Kabirullah. Let me also appreciate the editor of this magazine, who has worked tirelessly to make the piece a reality, and that is no other person than our national PRO in the person of Dr. Mustafa Yakubu, consultant cardiologist. Where are you, sir? That is our indefatigable editor and national PRO. Jazakumullahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Yes, we thank the president for presenting the e-copy of the Al-Ijtihad magazine. Al-Ijtihad simply means struggling or striving. So like what the MD, the vice chancellor was remarking, IMAN does medical outreaches on a regular basis. We go to various communities. I cannot count how many communities I have visited, and the same thing, our various states and branches. When we go through this report, we are going to see. We visit places where even their water, you would think it is Fanta, and we drink it like that with them. We sleep in places where the mosquitoes are so heavy, you feel them perching on you, just to render services to the broader community that don't have direct access to improve healthcare services. So IMAN has actually been doing this in different ways. May Allah continue to strengthen us. The IMAN Medical Journal, which is the journal we publish, which is a research-based journal where we present our abstracts and reports, is also available in my medical journal for our picking copies with us. We also have our Ibadah-friendly guide, which one of our speakers has earlier alluded to. We have copies of this publication which we can get, which tells you how to actually help patients to ensure they do not lose touch with their religion during sickness or during hospitalization. We thank everyone for being with us. And finally, I'm going to call upon the chairman to give his closing remarks. And thereafter, the national secretary will give the vote of thanks and we give the closing prayer.
Assalamu alaikum wa rahmatullah. It is a great pleasure that we came here and then we ended successfully. So I wish each and every one of us here journey mercies when you return back to our respective places. Thank you very much. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
A'udhu billahi minash shaitani rajim. Bismillahir rahmanir rahim. My duty is to thank all of us. I will start by thanking Allah subhanahu wa ta'ala for sparing our life to this moment. We know so many people who will have died between last year AGM and this year AGM. We are aware of so many people who are aware of this today, that the program is coming, but they are not alive to witness it. Here we thank Allah subhanahu wa ta'ala for this opportunity. We thank him also for making us starting this program as scheduled, and we are rounding it up now. We may not know what it means. So many things can happen within this hall, and the whole thing will be scattered. So we thank him for this opportunity. We cannot thank the chairman of this occasion enough, the Vice Chancellor of Gombe State University, Professor Usman Ofati, every represented by the DFC ACAD. We are very, very grateful for your presence. It has had color to this event. Without you, if we are sitting down alone, there's actually no opening ceremony because we are the same. We'll continue to meet. So your presence is worth it, and we pray Allah subhanahu we want you abundantly. We want to thank our guest speaker, Dr. Muhammad Sadiq, from far away University of Sefi. If not for the passion for the healthcare service in this country and your call for service, you will not be here. It is not easy. No matter what we have provided, it is a lot of risk. It is a lot of sacrifice. In your own little way, you have provided this service to humanity. You really will not know how many people you have touched with your talk, and people will start thinking in their head, am I doing it right? I've actually made another person to smile. So pray Allah will reward you abundantly, and will make the reward heavy in the scale of your good deeds, both in this world and the hereafter. We want to thank the Chief Medical Director of Federal Teaching Hospital Gombe. He has given a lot of support, both financially and morally too. Your speech, we came to visit you 2 days ago. We are supposed to preach to you, to advise you to do very good work, to ensure that you accomplish your tasks, but you successfully admonish us too. And we left us thinking about the message. This is what we expect for a Muslim, because it's just beyond the service to what people think. It's also you are thinking about the hereafter. May Allah reward you most sincerely, and we appreciate your gesture and your team that is working with you. Both those who are present here and those who are not here, we appreciate you all. May Allah reward you abundantly. The Vice Chancellor of Penn Resource University, who has donated a space for our students to stay, they are the leader of tomorrow. Without them, all of us are aging, whether we like it or not. We think we are all young, but there's no doubt about it. Age is counting on us. So we depend on those people coming behind, and that is why, as a duty of IMAN, we want to train them as well so that they take over from us. The provision of that accommodation is not in a small way. It has made a lot of support to us and to them too. We appreciate you, and you have also found time to be here. And we actually appreciate your counsel too. May Allah also reward you more abundantly. Our medical aider here, Dr. Shaidu Abubakar, the chairman of the local organizing committee, and your team, you have done wonderfully well. It's a lot of sacrifice to want to host a lot of people. You are thinking of people on the road. You are planning how to feed them. You are planning the transport. We know it's not easy, and we know it's a lot of sacrifice. And you are also here with us. May Allah reward you and your team more abundantly. Dr. Mukadas, who is also here, the message and your presence here is a sacrifice. There's many places you go to, you are in their territory. You even in their office, they are not there to welcome you, talk less of even coming to your occasion. We did appreciate this most sincerely. The permanent secretary, Alhaji Danladi Adamu, who is also an IMAN member, and the pharmacy, Muhammad Jallo, we thank you for welcoming us yesterday and also gracing this occasion. We hope that anywhere we go, you have to follow us because you are a member. First and foremost, you are a member before the position you are holding. So please follow us to anywhere you go and we'll be in your spirit. May Allah give your task for you and give you a successful tenure, all of you. The former CMD of Abubakar Tafawa Balewa University is also a member. Dr. Muhammad Al-Kali is also here. He has been present in all the meetings we have been to. He had as CMD, he had as Amir of the IMAN, he works as the chairman of a committee. Allah see what you are doing and he knows your input. He will reward you more abundantly. We appreciate you and we recognize you. We thank the members of the National Organizing Committee of this conference. People are from far place and from near place, and they have been here several times to ensure that this occasion is successful. They are putting their sacrifice, they are putting money, so Allah will reward you more abundantly. The LOC committee, the subcommittee, we cannot count your name, but Allah sees you and I see what you are putting for this occasion, and we pray He will reward you abundantly. The print and electronic media, for covering this event, we appreciate you, and we thank you most sincerely for covering our event. All our members in the chairman of different committees who have organized the conference workshop, you have impacted life. Is part of what the Prophet says, part of a good Muslim, somebody who has knowledge and is ready to transfer that knowledge to other people. That's what you have done. We pray Allah will reward you abundantly. We want to thank all our members who have come from far and from near. The sacrifice cannot be counted. We know what the country is saying now. There's a lot of issues about security. But even without this, you have put your life at risk for the service of Allah. We pray Allah will guide you safely to your destination, and we wish you a pleasant stay in Gombe. Those people who have mentioned and people who have still, Allah sees you and we think He will reward you more abundantly. Assalamu alaikum wa rahmatullahi wa barakatuh.
The National Secretary has been thanking the people, so let me thank the National Secretary on behalf of all of us too. I will call the Amir of the state, that is our main host, to come around. No, you got to say two things. Please come. Stand up. That's our digital Amir. So, when we ought to call him earlier, he was inside the crowd. So,
Assalamu alaikum rahmatullah. I do not have to talk. I didn't want to talk, but he insisted. I think, first of all, our gratitude to Allah subhanahu wa ta'ala for enabling us to see this day that we've been preparing for in the last 1 or 2 months. We also pray that the conference is going to be very successful. May Allah subhanahu wa ta'ala make it easy and fruitful. Secondly, as IMAN Gombe State, to be given the hosting right, we thank the National for giving us this hosting right. It's this privilege that you can hardly get. We also thank all and sundry who have supported the success of this conference. Notably, maybe the Federal Teaching Hospital, the Gombe State University, the Gombe State Government, the Gombe State Health Contributory Agency, and so many others, especially also the Federal College of Horticulture, Federal College of Education, and Pear Resource University. All these institutions have immensely helped in the success of this conference. So we thank you so much. May Allah subhanahu wa ta'ala reward you abundantly. For IMAN, like you see that this is the 24th conference, but for us, this is the second time we are hosting such a conference in Gombe. The last time this conference was held was in 2006 in the State Special Hospital and College of Nursing, and today we are doing it in this place. We essentially do two things as IMAN. Dr. Sadiq, the guest lecturer, has touched a lot of issues that are really disturbing in the healthcare sector. No matter how much you want to save the healthcare sector of this country, you cannot do it alone. You need a collaborative effort. But we've taken upon ourselves two things essentially to do. One is to help the needy patient. He has touched on that. You have the skills, you have the tools, but the patient that will access the service does not have the means to access the service. This is so much disturbing, and no one is anywhere around the country to help this person. So we, in our own little way, we try to help the needy patient. A patient that will come does not have the wherewithal to pay for health care. If from our little resources, we try to see how we can help him. Every health worker, every Muslim health worker, when I say health worker, I mean every person working in the healthcare industry. Every Muslim healthcare worker contribute 1% of their basic salary to the services of IMAN. And this is what we collect from the sub-treasury and share across the different hospitals. We have 24 branches in Gombe State. Cottage hospitals, we have 12, and we have 10 general hospitals. We also have the teaching hospital and the College of Nursing. We share these resources across all these branches for the needy patient. The second thing we do is we talk to ourselves. As you all know, not every healthcare worker has the characters of healthcare service. We try to see how we support each other, modeling characters and also admonishing each other on commitment to work, on discipline, on ethical matters, and so on and so forth. This is essentially what we do. We need the general public to support this system, or this noble opportunity, or this noble project that we are doing. We cannot do it alone. We need a lot of support. Philanthropists, governments, non-governmental organizations, if they can come to the aid of IMAN, it will go a long way. IMAN is different. It's the one and only umbrella in the entire country that is putting every person in the healthcare sector together. Doctors, pharmacists, lab scientists, nurses, community healthcare workers, including drivers, laborers, engineers, accountants that are working within the healthcare sector are members of IMAN. I don't think the entire country, there is a similar organization like this. I don't think there is a similar organization like this. But the support, the recognition, the understanding of the general public for IMAN is not what it ought to be. So we are calling on the general public to look at the noble project that we are embarking upon and to see how they can come into the support. And another thing that is beautiful with IMAN is that our leadership is not permanent and pensionable. It's a dynamic leadership. Like you had the national president saying that this is an election year. So it is expected that the leadership, the tenure has come to an end and another leadership will take up. So also at the state level. And it's the same thing as the unit level. Every 3 years, leadership will change. And I think this is one thing that Muslims to put together in Nigeria are lacking. Lack of that dynamic leadership is taking us back. you just look at the traditional setup of every institution. If one person will be there, like they say, you suffer from the Peter's principle. One day, one time, at a point in time, you will lose your stamina, and you are carrying alone an entire burden. Some of the organization, people are leading it for 50 years. One person leading an organization for 50 years, 60 years. Some people are even 90 years old, and they are still the leaders of their organization. For heaven's sake, how will the organization move forward? So I think this is one thing that is dynamic. This is unique with IMAN, and we are benefiting so much, because no matter how bad a leadership is, time will come when this leadership will go away. And no matter how good the leadership is, the time will come when that leadership will go away, and people will begin to understand, oh, that person is important. We need to look for another person like him to come and lead us. So this is what IMAN is doing, and I wish us all the best. And I also hope that we'll have a very interesting, one spectacular conference that is one of its kind in the country. You are all welcome to Gombe State, the jewel of the Savannah. Thank you. Assalamu alaikum.
Thank you very much. You've listened to the Chairman IMAN Gombe State. So we are going to the end of the formal opening. We will urge us all to pray for our brother. Of course, many Muslims have died from yesterday to today that we may not recognize, but Allah subhanahu wa ta'ala in His infinite mercy has made some names higher than others. Sheikh Giro Argungu, Allahumma gifri lahu warhamhu warhamna ba'da. Allah took his soul yesterday evening. His janaza should be this afternoon. We want to beg all of us in our little ways, let us pray for him. May Almighty Allah forgive him. May Allah accept him. May Allah cancel his errors and accept his efforts. Similarly, all other Muslims across the country, across the world that have died, that would also be entered this time, this afternoon, today, we pray may Allah forgive all of them. Allahumma ghfir lahum ajma'in wa ghfir lana ajma'in bi rahmatihi wa arhamar rahimin. اللهم اهدنا فيما هديت وعافينا فيما عافيت وتولنا فيما توليت وبارك لنا فيما أعطيت وقنا اصرف عنا شر ما قضيت فإنك تقضي ولا يقضى عليك إنه لا يذل ما وليت ولا يعز من عاديت تباركت ربنا وتعاليت نستغفرك ونتوب إليك ربنا افرغ علينا صبرا وثبت أقدامنا وانصرنا على القوم الكافرين ربنا آتنا في الدنيا